Hello, everybody. Welcome. Today is our day 5 of the World Health Summit, and my co-host has been doing a wonderful job, introducing everybody every single day. We just have a little flip today. I am going to go around the table. We have the 6 of us talking to y'all today, so please do comment, let us know, post any questions you have. That's what we are here to have a conversation with y'all. And I hope every single day you had a wonderful time taking notes and all the takeaways, what you want to do, what you want to try to implement in your life from this time on. We have had great speakers last 4 days, and have your worksheet ready for you to take notes. And anytime you can reach out to any one of us, or if you want to reach out to me, if you have a specific question for somebody, I can always connect with them and get back to you. And as I said, today is our day 5 and our final day. It's a live session. We are broadcasting on both YouTube and Facebook, so whichever platform you all can watch. And I'm just going to start by introducing myself. For those of you all who do not know me, I am Rajitha Bommakanti, registered nurse, faith-based holistic coach, and founder of Healthy You Lifestyle Center. And my mission is to empower you, inspire you to develop healthy habits for life. And I know it's not easy. That's what we are here for. There's plenty of evidence-based practices. That's what I coach and I talk about. There's a lot of information on the internet, but it's up to you what you want to take in. You have to be very mindful of that. That being said, Anne, can you introduce yourself?
Yes, thank you, Rajitha. And just want to give a really shout out to Rajitha. She has done the lion's share of this World Summit and really want to congratulate her. I've been able to follow along and listen to all the sessions every day, and it's just been amazing to see the talent and the expertise that you've brought together. And I really hope this can stay up for a while to let other people see it. I hope you'll all share it. And congratulations for a job well done. My name is Anne Llewellyn. I'm a nurse by background and live in South Florida in the Fort Lauderdale area. And have been known Rajitha for a few years as a colleague in case management. We really met on Facebook. I think we might have met at a conference once or twice, but we've really stayed in touch through social media. So it's amazing how social media is allowing us to network, even with this pandemic that we have around the world. We have somebody from India on here today. Just amazing. And I am a nurse, as I said. I've been a critical care nurse since 1978. I graduated and then went into worked in the hospital for a number of years in acute care. Then went into case management, which is what I really found my niche in. I really love case management and seeing how when people have the right resources, they can really overcome so many obstacles, challenges that could ruin their lives. But when they have the right resources, they're able to really reach their fullest potential. And many of us, I have a lady right now I'm working with, she has a bilateral amputation of her hands. Now you can just imagine how that would be if you had no hands. And she's the most positive woman I've ever met. And we just got her approved for prosthetics. Awesome. She's on Medicaid, and they originally wouldn't cover it, and we just got her approved. So it's going to change her life, really, literally. So I've been involved in case management and actually have my own health issue where I had a brain tumor 5 years ago. And I've recovered, thank God. I got to a good doctor, had chemotherapy, and have recovered. And now I really have turned my work to what I call nurse advocacy, to really help people navigate the healthcare system and find their way through this complex system. And it's been really a great journey. I'm learning a lot and really finding every day that we really do need to work together, because this system, it's the best system in the world we have here, but it's the most complicated system to work through. And if you don't have an advocate to help you, it can be very difficult. So I'm glad to be here, looking forward to the discussion and meeting everyone and sharing information.
Pat?
Yeah, good morning, everyone. My name is Patricia Romboletti. I live in the Atlanta, Georgia area, and I'm a career coach. And if you might wonder what that has to do with health and wellness, there is a component of everyone's career tied to their finances, and their finances are tied to the stress level that they have. And when I, as a career coach, coaching executives, I spend a lot of time on mindset, on having them guard their mind, guard their emotions, and helping them stay away from stress. It's one of the first things that happens is they lose a lot of sleep. And once they lose a lot of sleep, it's a spiral. So it's a very holistic approach, not just let's get the resume straight, but let's get your whole mindset and life straight so that you show up the most powerfully when you are interviewing and exploring. So I'm excited to be here amongst so many great participants and speakers. Rajitha, thank you for allowing me to join, and hope I can add value to your audience.
Thank you, Pat. Nancy?
Hello, my name's Nancy Green. I know Pat. Pat has been part of my life for a long time, and she is a holistic angel in my world. I come from healthcare, but I come from a technology background. So I have a consulting company that focuses on digital health and accelerating companies in that space. And that includes telehealth. So I think we're going to talk about that today. How can some of the advanced technical solutions that are out there, even some of the simplest ones, how can that make a difference in people's lives?
Thank you, Nancy.
Thank you, Rajitha.
Letha?
Hello, Letha Joseph, joining from North Carolina, United States. So I was born and raised in India, and my nursing journey started in India. I'm graduate of Rajkumari Amritkaur College of Nursing, University of Delhi. So that is where my basic BSN education from. My master's and my doctoral studies were from University of North Carolina, Chapel Hill. Currently, I work as a nurse practitioner for Veterans Healthcare System in Durham, North Carolina. Additionally, I am an adjunct faculty in an honorable role with University of North Carolina, Chapel Hill School of Nursing, and a consulting associate and clinical instructor at the Duke University School of Nursing. So both blues, the Duke blue and the Carolina blue, comes natural to me.
Rivals.
My interest in clinical practice includes diabetes. That was my research project about, and I have published papers in diabetes among Asian Indians and diabetes and comorbid depression. Additionally, my interest includes work-life balance, shift work and nurses' health definitely, and lifestyle modification. So it is not focused to a special dimension. It goes everywhere because I am an adult gerontology primary care certified nurse practitioner where I see patients from 13 and above with all sort of healthcare problems. As a volunteering primary care provider for Open Door Clinic of Urban Ministries of Bay County in North Carolina, I have taken care of patients who are uninsured, underinsured, so marginalized and having inequalities in healthcare and outcomes. So I have seen the good, the ugly, the bad, everything.
Yeah.
So I'm happy to be here contributing from my experience and the evidence I have seen. And looking forward to a good discussion to learn from the other panelists and contribute from my own.
Thank you, Letha. Sharda?
Hi, thanks Rajitha for giving me this opportunity. I'm really looking forward to learn a lot from my co-panelists. I have a doctorate in sociology, and I've been a researcher, academic teacher, and also a trainer. Currently, I'm a program manager. I'm the director of an organization called Population First, which works on health and population issues from gender and social development point of view perspective. Basically, we believe that population issues, whether it is maternal mortality or child mortality or whatever it is not because of overpopulation or the large number of population, but because of unequal social development and the gender inequalities, which deny women basic access to services, abridge her rights, and perpetrate gender violence on her. So we work on that. So we have two projects. One, we work in 200 villages in Maharashtra, where we are working on social development issues, focusing on women empowerment and community mobilization. And then we have a major project with media called Latli, which means a cherished child, where we are trying to address the misogyny in the media and also to promote more sensitive and in-depth analysis of gender issues in media, particularly print and electronic media, as well as in films. So we work extensively with all the media leaders and media professionals. So these are the two projects that we do. And basically our motto is to be the change makers in society.
Wow, congratulations.
Thank you, Sharda.
Excellent.
Vandita?
Thank you again, Rajitha. I'm truly very happy to be here along with everybody, and you're doing a great job to get all the people who walks inside the professionals from all our fields come together and discuss health and mental health. And I have been following you all for the week. I'm truly amazed. Thank you again. Vandita Parich, my background is I've done Indian classical dance for around 8 years, and then I moved on to learn Indian folk dances because I wanted to connect with various states, their backgrounds, their social backgrounds, and now I'm practicing and teaching folk dances for theater. And my background is I've also studied criminology. My subject was victimology from India, from Gujarat University in Chennai. And then since I moved here, I've been just practicing dance. But how I'm connected with what I do with my dances, I have a project called Nritya Seva, where I use dance as service and connect with local charities and charities from India and have empower them through dance, especially women and children-related charities. And at the same time, I also have a lot of students who are autistic and special. And dance has really worked as a therapy, very holistic. And that's one thing that is very dear to me. And that's how Rajitha and I got together and so
Awesome.
Thank you, Rajitha. All right, so I just wanted to start off with our first topic for the day. This pandemic has exposed us with huge disparities that we are seeing, how it disproportionately affected certain group of people versus the other, and especially the ethnic, minority groups. It affected more of African Americans and Hispanics, primarily here in the U.S. And and also, I think from what Sharda was saying in India, there is some of the, people that have lower economic conditions because of the environment they have been in. So, keeping that in mind, I just wanted to say, ask Sharda primarily right now with the living conditions in India, in certain pockets of the area where it's so densely populated, and it has been, I'm sure it's been very difficult to practice the distancing and being isolated in order to, prevent the spread of the virus. So can you talk to us a little bit about the challenges you guys are having there in India, and how, if anything, you're able to do to overcome those challenges.
Uh, yes, it's Mumbai has been having a lot of challenges. Mumbai is basically a vertical city like New York with very high density of population, around 22,000 people per square meter of land. But the density in residential areas is estimated to be around 110,000 per square kilometer. And that's a huge number. And 42% of Mumbai population lives in slums as low-cost housing is not available, and two-thirds of them live in one-room facilities. So you can imagine the kind of pressure that we have in terms of accommodation. Density in various slums is very high. For instance, the population density in Dharavi, you must have heard about it. It is one of the biggest slums in India. Is around 277,000 per square kilometer, not mile, per square kilometer, 277,000, which makes social distance next to impossible. With more than 50% of the slum population using community toilets, their vulnerability is multiplied manifold. The high density of population also causes overcrowding in public transport, markets, all public places, making it impossible to maintain social distancing. Since isolation is impossible to maintain, is quarantine or not possible at home in these circumstances, where 6 to 8 people occupy one room facility at different times of the day. So some people go for day duty and some people go for night duty. So 6 to 8 people share one room facility. So more and more people are having to be placed in institutional isolation and quarantine, stretching the already burdened health system beyond its capacity, leading to more deaths. Some governments have stopped testing the asymptomatic carriers to reduce the burden on the health system, but it is compounding the problem in its own way. Mumbai has 53,000 corona cases, that is one-sixth of the total cases in the country, and around 1,800 deaths, which is one-fifth of the total deaths in the country. Predictably, 60% of the city's deaths are reported from the slums and slum-like areas, according to the data released by the municipal corporation. I think I really wish and I hope that we treat this as a wake up call and work towards decongesting our cities and ensuring better living conditions to the poor and the marginalized.
All right. Wow, that's very, very challenging to manage that type of a situation. And I am sure, as the things are opening up now, it must be even more challenging um,
Sure.
if, with people. So, yeah, that's a public health nightmare there in India. Thank you, Ishwada. So I just wanted to ask Letha about, how does it affect, like here in U.S. for us, Letha, regarding the some of the essential workers that have been out there working in their fields, and it's been hard for them to manage, especially Hispanics that work in meat processing areas where they have been exposed to all of this virus and all, they come back home and live. So, what are some of those challenges and how that's been going on in that area for them?
Yeah, similar to Bombay, US also has challenges. Similar to any other country, whether developing or developed, when it came to COVID-19, there was challenge for any nation in any developmental stages. The sociologic and the epidemiology experts, they point out mainly four broad factors. Those are responsible for disparities in COVID-19. And not only the prevalence of COVID-19, but the outcomes related to the disease. They are residential segregation, employment status, economic inequality, healthcare access and quality of healthcare they receive. Speaking of employment status, since I am mentioning the essential workers here, let me highlight the employment status and how it increases the risk for contracting the coronavirus. For example, a large group of ethnic minority workers are in jobs which are considered as essential fields, and they do not qualify for the work from home status. For example, healthcare workers, people who are in transportation, store attendants, hospitality and room services, food and agricultural industry workers, etc. are some examples. Around 50% of food and agricultural jobs are occupied by minorities and people of color. And then we know the gig economy, which is from the temporary workers who are working either on contract or on daily wages. Majority of the people are Latinos. So for those people, there is no provision of working from home. So they need to go and expose themselves, because putting food on the table is the primary responsibility or primary need. So they get exposed. Then they have all the other drawbacks, the crowded housing, inability to have good health care, or even lack of health literacy to monitor for the symptoms and stay away from work or stay away from others. So them disproportionately getting affected due to this coronavirus is not something we probably can prevent unless there is big social reform. At this time, when the country is moving without a big direction, how to open, how to reopen, how to stay in business, I really wonder and hope for a remedy to protect all these poor people.
Oh, thank you, Letha. That's been challenging. It's not just in small developing countries. Even in a country like U.S., we all are facing these challenges, and these are tough things to address. And some of the challenges have been politicized, but that's just besides another topic. But also, how are the underlying conditions affecting these people? Their underlying chronic conditions they already have prior to us being exposed to this virus.
It's interesting, because when someone is already compromised with an underlying condition, how much we can anticipate the person to bounce back? The more sicker you get, the lesser your chances of survival. That is not a brainy question. So last week, a study was published. The study was an observational study done in Oceaner Health System in Louisiana. This large healthcare system, one of the top 10 in the United States, they care for nearly 500 million population in Louisiana. And among the population which this healthcare system serves, 2/3 identify themselves as white, non-Hispanic. And nearly 1/3 identify themselves as African American or Black, non-Hispanic. There might be a minor population of Latinos or Asians, but this is the major population. So the study looked at people who came in with symptoms of COVID-19 and later on found us positive for COVID-19. So now they had 36,000 patients presented with the COVID symptoms and diagnosed as having COVID positive. Interestingly, 70% of patients who became positive for COVID-19 were Black people. Though the system has 2/3 of white population in their healthcare system, the COVID-19 cases, 70% were for Black people. So we need to really understand the increased risk, whatever demographic reasons, whatever population health related reasons, epidemiological factors, we need to understand this underlying increased risk for colored people to contract this illness. And these patients were with comorbidities such as hypertension, obesity, kidney issues, diabetes, etc., as compared to the people who are white and had the disease. Now, we know these comorbidities are not pretty. They are kind of like increasing the risk for poor outcomes after the illness. So in the beginning of April, a paper was published in the JAMA. So that paper analyzed COVID-19 patients admitted in the month of March to different hospitals in the country. So 99 counties were represented in this large study, and these 99 counties were from 14 states who were having COVID-19 cases in March. So it kind of like represented the US population based on the statistical analysis. And according to that data, the hospitalization for COVID-19 patients were 4.6 per 100,000 population. And 90% of hospitalized patients had some type of underlying condition. Guess what was the highest underlying comorbidity? It was hypertension for all the age group, starting from 18.
Wow.
And in which was the second comorbidity? It was the obesity, except for older adults. The number 2 was obesity, except for older adults, patients 65 and above. They had cardiovascular diseases as the number 2 comorbidity. And what is cardiovascular disease? What is obesity turning to? And the other comorbidities were chronic lung disease and diabetes. So now I'm coming back to the Louisiana study. So in Louisiana, when they looked at the outcome for Black patients were similar to white patients. That means the color did not have an impact on their outcomes. It was an independent factor. But what was the factor which affected the outcome? Their comorbidities. So Black patients needed more ventilation. They needed more intensive care unit care because they came in with severe illness. When they presented to the hospital, they had higher symptoms than the white patients. Also, these patients had higher levels of comorbidities, so their outcome was poor, not because of their color. So we cannot blame it on the gene, but we can blame it on many other social determinants of health when it comes to outcome related to COVID-19 and any other public health issue we can kind of like in general say.
So you're saying in terms of that, we can't blame it on genes, but it's our lifestyle, because you said hypertension, obesity, cardiovascular disease, is that what kind of primarily the study is driven down to?
So the study was actually focusing on comorbidities and its effect on COVID-19 outcomes. Speaking of cardiovascular diseases, speaking of obesity, speaking of diabetes, we all know the genetic component for that. And lifestyle modification, I think we are coming later on in the discussion how to get a better lifestyle modification or better eating habits, everything. I will save all the thunder points for that time discussion. However, genes might have an influence for comorbidities. However, having the comorbidity increases your risk for dying from COVID-19 or getting severe disease of COVID-19. We are coming to a point where nobody can probably escape from COVID-19. Now, how bad you are going to be affected? There are certain factors you can guide in your life. If you have blood pressure, take your blood pressure medicines, keep your blood pressure under control. So even if you get affected by COVID-19, your outcome will not be, you will not end up in a ventilator, you will not end up in the ICU, or you will not die from that. If you have diabetes, make sure that your blood sugar is kept under below normal, so you will not be increasing your risk for death from COVID-19 by uncontrolled blood sugars. Get a physical activity every day, even though you are not able to go out much and do your exercise. But get the physical activity so your lung is kept in optimum state. So even if you get COVID-19, you are not developing pneumonia and ending up needing oxygen support and in the hospital needing a ventilator support.
Wonderful. Yeah. Thank you, Letha, regarding that. That really helps. And then later on in our discussion, we will also be addressing the genetic component of it and the lifestyle, as you just said, because, genes are not our destiny. So that's what we are going to talk about. So in that, I also wanted to ask Pat, that we're just talking about. Okay, there you are, Pat. In terms of our lifestyle, you are a career coach. You talk to, various professionals out there in all different levels. So tell me a little bit about that lifestyle that we do have, every day that we go through.
Yeah. Well, I mostly work with senior level executives, and I mostly work with them initially when they have had the first exposure where they've just lost their job or have been in a job search, right? So, their lifestyle, by the way, was focused around their job. Their identity was focused around their job. And their structure was focused around their job. So when they wind up being not working and are in transition, it's a very big disruption of all of that. First, it's just a disruption of their routine. So a lot of times it takes them a while. They may have had a great routine where they worked out every morning, then they went to work, etc. But when they're in transition, they're so thrown off at first that it takes them a while to get back into that quote routine. That's one aspect. The identity removal puts them in a real state of stress. The uncertainty, which everyone has experienced with COVID-19, anybody who's in transition has experienced, right? And one of the things about the COVID-19 experience is a lot of the folks that I coach, a lot of the folks that I know and I have in my workshops and meet and talk to, they had already been thrown off. So something changed. And we all know when something changed, the stress level goes up, which means if you have already any kind of hypertension, any kind of illness that is related, that stress aggravates, then that all goes up. And then many times by the time about 90 days, they're starting, if they're getting some help anyways, they're starting to settle in. And now they've got their new normal. And now along comes quarantine. Along comes the inability to get out and network with people. Along comes another change. So they had a big change and then a second change and now a third change. And I certainly saw a huge difficulty with folks when we first went into the quarantine state, making that second adjustment. It was sort of like, wait a minute, I just got some stability, right? So right now, in my coaching group, clients, there's some that have been in transition for a while, and it took them a good 60 days to get up and back on their feet after they, had that second change. And then those who just find themselves in transition as a result of COVID are going through both the job change and going through job change in a time when there's complete uncertainty. So you already have uncertainty, more uncertainty raises the stress level. And the number one factor or issue is it causes issues with their sleep. They're tossing and turning and worrying and overthinking. And I do a lot of work with my clients on it's good to be thinking, but don't be overthinking, but it's natural, right? So, you just have a downward decline when you start not sleeping enough, when you are facing stress, and when you're facing uncertainty. And so quite honestly, what I work with my clients and started immediately in my workshops, et cetera, and in my coaching, the very first thing I started doing was, we addressed the immediacy of the quarantine, and we spent some time there. But as quickly as I could see them to be ready, I turned them into looking forward. What would be next? How do they navigate this? And what will be the future in their industry? And the reason I did that is because when you're forward facing, you're in action. When you're in action, you're less in stress because you're starting to say, and my focus is, what do I have control over? With our health, what do we have our control over? With our wealth, what do we have our control over? And of course, your career is tied directly to your wealth. And as I've seen throughout my practice, also to your health. So point being, it's been a difficult, stressful journey for most, and this just added to that. And the cure, if you will, has been looking forward. And also the cure has been getting exercise. And I harp on that with my folks. Like, I'd rather have you spend a half hour out exercising and getting some fresh air and doing something than inside worrying about whether your resume is perfectly structured right now. And when I can get them back on normal, healthy sleep routines, less worry, and more monitoring of their mindset and their well-being, then we can work most effectively on what's next in their career. But that has to come first. It's maybe counterintuitive, but if I try to put the career and the resume and the interview skills first, and they haven't got the underlying stress and well-being taken care of, they won't do well anyway. So that's been the real focus. And it's really important to understand how natural it is and have those folks monitoring where they may have had some real awareness and rhythm to their health routine, et cetera. Once it gets shaken up, I have to get them back on that first.
Okay, great. I just wanted to, Anne had something to ask you, Pat.
Sure.
Yeah, Pat, I was wondering, do you ever give advice to, especially I guess, executives or people who have lost their jobs, just to really kind of try to relax and to let that time when they're not working to recuperate and to heal?
Yep.
I found that really helpful when I got sick. I had I lost my job because they needed somebody to fill that job, and I couldn't do it because I was sick. But after I started to get better, I was lucky to have a disability policy that allowed me to stay off of work to heal. And it really, I think, helped me physically, mentally. I didn't have the stress of having to go back to work because of income. I mean, not that I was wealthy and we had a lot of money but I had at least some income coming in through the disability policy. So, and then also, I'm sure all of us have experienced when we've changed jobs. Like, even if it was a layoff or if it was a voluntary change, a lot of times we don't give ourselves that time to heal or to really just take a breath and relax between jobs. We have to get something right away. And sometimes then it's not even what is good for us, that we jump back into the game right away. Well,
let me address what we face in the marketplace before I answer that question.
Yeah.
Wouldn't it be great if somebody could say, I lost my job, I had enough money, so I took 90 days and 6 months off to regroup, and now I'm back looking for a job? Wouldn't that be great? That's not the way the marketplace does not react well to that. In other words, the sensitivity at the hiring level is not, oh, that was a good thing. At the hiring level, the problem is, well, we don't think you're a hard charger enough if you had to have this, right? So sort of that society, if you will, that understanding of it's important to take time off does not exist. So I have to strike a real balance with my clients about you need to start doing meditation. You need to do have a morning routine and have an evening routine. And I do some things that give them sort of mini breaks. And certainly, look, absolutely a week or two, catch your breath, etc. And I also urge them to try to negotiate that week or two before they start a new job to catch their breath a little bit. But unfortunately, we have to almost do mini sprints of, that's why I focus it that way, because the environment in hiring is very risk averse. So when you're being interviewed, they're not looking for what's right. They're looking for what could be wrong. And if they see, oh, you spent 60 days on the sidelines, I don't think you're really a hard charger. I don't think your careers are serious enough to you, right? Wow. And especially if they're interviewing with somebody who's never been in that place, never had that rug pulled out from under them. They have they haven't seen it through those eyes, so they have very little sympathy and empathy for it, right? So I have to help them strike that balance. Yes, we do focus on what I say is don't put your life on hold. So what I say is, I just did a whole time management workshop on Thursday, and I was showing people, you know, you don't have to work, quote, 9 to 5. You can stop at 3 o'clock and spend some time with your children. When kids were coming home from school, you know, I would tell them, be sure that you take advantage of this to go pick your child up at school and take them to the park. Don't put your life on hold. That's more acceptable, because nobody out there is saying how many hours a day were you in the search, but they're looking for those gaps, right? So definitely finding those things. And I still, even from an at home, it's like, you know, if you shut your search down at 3 o'clock in the afternoon, so that when your child is through whatever activity they've been engaged with, before it was at home schooling, now it's at home camp, you get to take them out and do activities with them, have an early dinner with your spouse. And that's the most important thing. If you had a vacation schedule, don't say, I can't take a vacation, I don't want to spend the money. I want you to say, I can't take that vacation, but it doesn't mean I can't take some vacation, right? So it's balancing that. But I also want to stress one other important thing. When I work with my clients, one of the other assessments at the beginning always is, what is your financial runway and what is your emotional runway? So if you've been an A player, hard charging, and you've been groomed by corporate America to be looking and climbing up the ladder, your emotional runway could be significantly, in other words, emotional runway for not being employed could be significantly shorter than your financial runway, because you've received perhaps you have a savings account to access, or you've received, you know, a package, right? And you've got 12 months, but in 12 days, you're so upset about not getting up and doing what you're doing. Those folks, I'm going to say, we need to get you back to work sooner. I know you don't need the money. You need the mental interaction. And then, of course, that's the other thing. I mean, we're all social distancing now. Imagine that you had a team of 100. You had people all over the country. You had this routine. You were traveling to your team. You loved your team. And now you wake up and you get up one morning and none of that exists. That rug pulled out from under you. They were instantly social distanced from their team and their organization without control over it. And they have already experienced what we are going through. So it's a very, very traumatic, emotional time. I will tell you that I start out by telling them, please understand, I know this is the most difficult thing you will ever go through. And then we work from there.
Interesting.
In that emotional runway, I just wanted to ask Ian a little bit about switching it towards our vulnerable population, how does this, stress affect the overall health and their immunity? Anne?
Well, I think, and Pat, you talked about the wellness and how if you're not adjusting and you're not sleeping, then that becomes a vicious cycle. People get confused. They don't know what to do. The world's upside down. And I think that can be in any population. That doesn't mean just high executives. It's in all of us.
Yep.
And the vulnerable populations and people who, as we talked about before, the entry workers, service workers, people who are in those front lines, if their jobs, the waitresses, the waiters, the people who are, doing yard work and things like that, people aren't spending the money because they're home or they can do it themselves now. They don't need to bring in people. Housekeepers, people who at that lower level, that lower rung of the economy, really, they're facing the same challenges as the executive is, but they don't have the money to hire a coach. They don't have the money they have to do it themselves, and they have to work out their own. So that's what I would wish we could see, and which we maybe there's nurses, there's other people listening. How can we help our communities to really, I don't know, and it's easy to say, take a breath. And I said, do you ever recommend that? And I know it's not that easy because you feel the pressure. And you know that if you don't get something within a window, it's not going to work.
Right.
But now with the whole country, and it's slowly reopening, but they're not opening everything, so they don't need all the people. I mean, Mayo Clinic laid off 30,000 people. How do you make that back up? And do we go back to that?
Mm-hmm.
So it's really a very difficult time. And I think, again, unfortunately for that underserved population, but, people are resilient. They are. Maybe they can just do something in their neighborhoods to help, volunteer. And I know money is important, but these other things that can help you get through it might be something. So I hope all of us who look at our communities can work together with our communities and start to bring ideas to help people cope.
Right. Rajitha, I just want to add something. One of the first things I did when the quarantine hit was I reached out. I knew a number of groups around the country that got folks together who had lost their jobs. And I immediately reached out to them and said, look, we have Zoom. If you can somehow get them. So I've been doing free workshops for those groups. I do lots of free workshops. And I do it specifically because I know not everybody can afford a private coach. Not everybody has access to that. That addresses people who have technology. Mm-hmm. Now, that's not reaching people who don't have technology. That's the only way I can do it. And I think, I remember the mayor of Chicago, not the current mayor, but the prior mayor, Emanuel, when he came into office, he said the only way we're going to fight poverty in Chicago is to get everybody a computer and technology, right? Mm-hmm. And he was right. And here's a perfect example of that. So I'm still missing people, even though I've been perfectly willing to do group work and offer that out there. If without technology, they're not able to access it.
Yeah. And I think, you're one person, you can't do everything, right. But all of us together, what can we all do? And meaning the audience, what can we all do to help with this?
But Mother Teresa said, if everybody swept in front of their door, the whole world would be clean. Yeah. So it is one person at a time.
And also, doing that community service, doing that free a service to people that really brings out your emotions out, where you're more healthier, it also affects your well-being. Yep. And how you feel about yourself. Yep. Whether you have a job or not, when you're trying to go out and reach in the community and help. And as Anne said, not just for all our panelists here, but for all our viewers, whatever, in any small way, whatever difference you can make in the community, it will make a huge difference within you too.
Yep.
Not just your community, but also it will help you.
Yep.
So as you were talking about the technology, Pat, just wanted to bring Nancy in. As we are going through, some of the smaller rural hospitals are not going to be surviving in this economic impact that we have had last few months, no surgeries, things like that. And also some of the individual primary care physicians might not be able to survive because, if they don't get something in, for so long, they didn't have anything. And for those population that live in rural areas, we have always had, even before this pandemic, we have had challenges about reaching the healthcare facilities. Is telehealth going to help in this type of a challenge? What's your take on that?
Yeah, so I think the big answer is yes, and it has. Telehealth's been around for a very, very long time. I started in it probably about 20 years ago. The pandemic forced everybody to it. So those that were laggers, that were like, oh, it's going to take my job away or something like that, are now forced to do it. So, but Pat's point is very strong. The problem is technology, not necessarily rural or urban. There are people in urban areas that will need and still use telehealth now. The problem with rural areas is the technology and networks. So there's a struggle with how strong is the networks out there. And a lot of them have gone into wireless areas rather than broadband. The technology is working over, a wireless network like a Verizon or an AT&T or something like that, versus trying to work on a broadband network that might not be built for that particular area. Mm-hmm. So I think as the business has changed, the comorbidity that we've talked about, and I think we're going to talk about a little bit later on remote monitoring those patients at home. But telemedicine absolutely kept people away from the facilities that they didn't want them in. So a person who didn't have any symptoms of COVID coming into a facility, they didn't want them there. They wanted them to stay at home. So telemedicine became a really good, strong tool for them, for the physicians and the nurse practitioners to be able to talk to their patients and keep them at home and cared for. They can do almost everything they need to do except put their hands on someone in a telemedicine. There are all kinds of tools for temperature and blood pressure and all those kinds of things. So is there a hindrance? Sometimes I think the telemental health providers felt that was a disconnect because they weren't in person, and they've learned that that's actually, the patients like it better. They feel more cared for. They see a doctor. This is not just a mental health, but across the board, they see their doctor and have access to them more and more. And physicians, be interesting to see on the other panel here if Letha has that same thing, but you can actually see more patients in this particular manner than anything else. So it's kind of more access there, for both the patient and the physician. They're able to actually utilize any technology. So a cell phone, you don't have to have a computer. You can actually expand into, a tablet, whatever you've got. Aging population has a little bit of a challenge, and there's some very specific things that we've been working on to get the telemedicine technology, a visual, into their hands. But in the lower, especially the millennials, that's how they would want to be cared for. So.
Thank you, Nancy,
Sure.
on that. So I wanted to ask Vandita here about how, if the community projects that we have talked about, since she has dance students, how would that help? Because you have some projects you do along with your students where they go out and do some projects. Can they do some projects in terms of helping the community, but also they're getting the project credit and also helping them towards that? Oops. Sorry, Vandita, wait a minute. You're muted. Let me unmute you. Okay, sorry. Go ahead now.
What I had, like I had mentioned before, in my dance curriculum, I have something which is called Nritya Seva. Nritya Seva, which literally translates into dance service. So this is for my graduate students. So when they enroll in my dance school, it's an enrollment process where the students are with me for 7 to 8 years minimum. And then they graduate with a diploma in folk dance and folk theater from India. So what I do is, initially I just started off making it mandatory that if you want to graduate, you will also have to have these many service hours. But like initially I had to push it on them, but now the students are doing it very naturally. So during COVID times, like there was a disconnect, normally, like I didn't know that I would face that in my career, but not having a laptop, not having a device, and not having the right internet connection even affected students from learning dance or from connecting, and that really hit me very hard, because I was able to go out, reach out to so many different communities. We have gone with Meals on Wheels, which is a project for people who are homeless. We used to reach out to them, teach dance, just provide them some kind of a therapeutic fun when they were having their meals. We used to go out to all these underprivileged areas, reach out to people, and have them just do dance yoga, which helped them. But now, without any human contact, without any devices or internet service, I was not able to connect to any of these people. So my students and I said, we need to do something and not leave our service project aside. So we started doing things like taking hospices. So there were a couple of hospices in North Carolina, and we connected with them, and I had my students send a drawing or a painting or a poem for the patients there. Then we did something which is called chalk art. I had all my students come out of their home, because they were also cooped up. I said, step out, go for a walk. And while you're going for a walk, you're going to clean that area. You're going to clean your neighborhood. You're going to do some plogging, Then I joined hands with another charity called One Earth, One Chance. And I asked everybody to come out and do some dance yoga with me on Mother's Day. I had all the mothers and daughters come out and said, let's come together, dance together. And whatever we make out of this, we are going to plant 22 trees. Then we did another project where I said, just come out of your homes, draw something on the floor, do some kind of game that you would play with your child using chalk art. So they had tic-tac-toe, and the parents were playing hopscotch, anything that was outside their homes. So these are the projects that I take to just have people have some kind of a mental outlet, to something to be happy about, to smile. And I always insist, put some favorite music of yours when you're doing this. So that way it also helps them therapeutically. So.
Wonderful. See, as we were just talking about community service, right? As we develop these habits into our children right from the very beginning, and it does not have to be in school, like Vandisa's program, it's after school, activities. It can start there. It can start at home. As long as we install these good habits into our children from the very beginning, that not only helps, the children and them, individuals, and the community. So
I agree, Rajitha, because like I said, initially, though I had to push it on them when they were little kids, but when these kids became 17, 18 years old, when they graduate, I know my students organize shows, fundraisers, and reach out to people in India. We've done a lot of community service for abused children. We've done for trafficked children. We've done for children who are for street hygiene and everything. And I don't have to tell them. Once they are 16, 17, it's like, we have to do 25 hours this week. Which our charity are we doing? They have already exchanged emails. They've already gone ahead with the process. It becomes a part of their growing up, And even the parents are like, initially the parents are like, we have to drive them to these areas. They will have to do all this. This is added work. But by the time they are 16 and these kids can drive on their own, it is Like, mom, after class school, I'm going here because I'm a big sister for this child. I'm helping Alzheimer's. I'm helping Dallas Rape Crisis Center. So the children have taken up projects on their own, and I really think that it is so important that it is part of their everyday, activities. And once we put this into them, it's no more work.
Yeah, thank you very much for that. I just wanted to step in a little into our next topic. I have seen one of the studies. COVID-19 has disproportionately affected women compared to men, especially women that are working in the front line, like the healthcare workers, Letha has mentioned earlier. And because of also juggling between professional life and personal life, they bear more responsibilities on them. Even though they are working outside, they still feel like they have to do things at home. They are managing people at home. So let me start with you, Sharda. How do we balance that? Because we all face those situations. How do we balance our professional and responsibilities and our personal responsibilities at home, and manage our stress levels?
Yeah, I would like to focus attention on the frontline workers in India who are majorly women, and they are doing a lot of work, in terms of, uh, conducting household surveys, identification and care of patients, and reaching relief to the people, to name a few. But unfortunately, most of them are not given adequate protective care, the salaries are not paid, and have no health insurance cover, and are exposed to danger of contracting the virus. They are also responsible for care of young and elderly at home, apart from the regular household chores. And in typical Indian context, most of the household work is on the shoulders of the women, and it is often a tough call for women to choose between their two roles and commitments. I feel the following will help in achieving some semblance of work life balance. This is from my experience of dealing with the frontline workers. One thing I observe is that women hesitate to ask for support and help because they think it is, in some way it reflects on their efficiency. So I very strongly recommend that women should ask for help and divide the household and care responsibilities among all members of the family. This is particularly true in the Indian context where the housewife is responsible for everything. And secondly, I feel we put very unrealistic expectations from ourselves. We should be realistic about our own expectations from ourselves. For instance, accept the fact that we need not be multitasking supermoms, perfect housewives, be house proud, and then wives and hosts, etc. It's okay to be not perfect. And once we are comfortable with that idea, I don't think we'll drive ourselves to such extent that we get stressed out and then overstretch ourselves, harming our own health and well-being. And third thing is outsource. Seek help and outsource jobs when required, when you can afford it, like getting house help or somebody professional doing some of the jobs that are required in the house, or buying some healthy products from the market and not trying to make everything at home. So remember, by doing so, you are providing an opportunity to someone to earn a living. It's not just that it's not that you're shirking your responsibilities, it's just that you're being smart about it. And set some routines and at home, and streamline work at home, because during this lockdown, many women have complained to the helplines that throughout the day they were demands of food and chai, I mean, for tea, coffee, varieties of food from different members of the family. In a family where there are there are older, elderly people, young people, children, the husband and men folks sitting at home. It was tremendous stress on the woman. But I feel that it is important to set some routines and streamline work at home. which is very difficult considering the way women are socialized in India, where they are only responding to the demands and not really sitting and setting up rules and routines in the house. And finally, I feel we all should learn to say no. Negotiate and be assertive at workplace. Claim your rights without compromising on our commitment and passion for work. Many times, work is dumped on women because they don't say no to the work, even if it is not her responsibility, even if it is not something which is part of her regular, responsibility, work responsibility. Most of the time, many jobs are dumped on women because they are not negotiating, they are not saying no to the work. That also puts lots and lots of stress on the women. Particularly, I see this in the case of frontline workers who are made to work for long hours with hardly any protective gear and without with hardly any time frame, fixed hours or anything like that. So this kind of thing, I agree, the systems have to change. We have to have more just systems, we have to have more efficient systems. But as women, I think we also should learn to say no and negotiate and be assertive at workplace and also at home.
I totally agree. That's a very good wrap up. We do need to give in some, and it's okay not be everything does not need to be perfect at all times, and things don't have to be exactly the way we want it. That is totally. I agree. That's one of these. I guess we all women have that obsession. Okay, things got to go exactly the way I want it. So, Pat, what do you have to say about that? The challenges that we do face.
Yeah, I think it happens in corporate America, right? So sometimes it's the woman is given, well, it's the same imbalance what you're talking about, whether it's at the executive level, the entry level, or anywhere in between. If they're afraid to say something's asked of them and they say no, will that be a bad check mark against them, right? That is that going to impact their career? It may, in a time like this, for a short period of time, it may mean that they get to keep their job longer because they know they can give them 6 or 8 things to do. And then they're working longer. And it's been really a problem for those working at home and trying to have the kids that needed teaching and all that routine. So, there's lots written about managers being more empathetic during this time for their workers from home. But I know that the women were taking on the bigger burden of the homeschooling, the whole change, right? So it's exactly what she said. We are not taught enough to think of ourselves, to follow the airline's direction of put your own mask on first. We don't understand that when we're not on the plane. And we say yes to too many things, hoping that we can use our great, quote, multitasking skills. So, and it affects women in their career, throughout their career, not just at this stressful time. But I think what I have seen, and what I stressed with my folks that are in transition, for example, is that now that everybody, for example, with COVID-19 is at home, that doesn't mean that just because you're not working, you get the burden of all the extra work. It doesn't work that way. You still are working. You're working on getting work, right? So it's just unfortunately socialized in us to say yes. God forbid that we be judged in some way. I went through it my whole career before I became a coach and had my own business. And I think every woman goes through it, no matter whether you're frontline worker or the CEO, for example, right? It does not matter.
Yeah, that's totally it's true. So let me see. I'm trying to unmute here. I'm having some challenges. Nancy, is there a way you can unmute yourself?
I am. Yep.
Okay, wonderful. Okay. So let me ask you about balancing, Nancy. What do you see in terms of women balancing?
I I second everyone, all the comments that have happened. I had that problem growing up and through my career, and actually Pat and I used to work together, and it was just this whole, what is the balance? And if you were the only woman in an organization, and in most of my career, you'd look around the table and it's like, I'm the only woman here. And it does create a different balance. I actually had my new daughter-in-law ask me, how do you do it all? I'm like, okay, well, you're married to my son, so he knows how to do his laundry. He knows how to, don't let him do all that, and so I think it's generational too, that we have to make sure that, we teach our sons that it's not just the woman that's there. And of course I have a great husband that does a lot too, but I mentor a lot of women, and that's one of the things that we talk about, what is to be, and I don't know how controversial this is, and my father taught it to me. I was at some event with him, a meeting, and I immediately stood up and started taking the dishes because we had lunch. And not in the meeting, but afterwards on the way home. I think I was only 16. I was working for him for the summer, and he said, don't ever do that. You diminish your value in a corporate environment by doing that. And I went, what? I said, but I'm supposed to do that. You taught me to help my mom, right? And he said, not in a corporate environment. And I have taught women that. And I had a mentee that she actually, I had already told her, and she stood up in a meeting when the last company I worked for, and I went, kind of looked at her strange, and she immediately sat back down again. And they all just sat there. Nobody did anything. The men just sure didn't do it. And they just sat there. We just moved them to the middle of the table and continued the meeting. So I think, and
Nancy, I just wanted to ask you with in line like this, because I know, as Pat was saying, a lot of people are out of work, and we know that. So I don't know if this is part of your business, but how are you helping people to cope with, I know a lot of online companies are using online application processes or programs, and people don't hear back. They don't know what's happening with the job. And I think that can be so stressful. Like, I know a lady right now is she moved from California to Florida, unfortunately, right at this time, and has not been able to get anything. And she's a nurse looking for a nursing job. But what do you tell people? How do they cope with that? Or is there other ways to get through the door?
So I think I can answer that question. I think Pat's better at answering that question. I know from my point of view, you really just have to be strong in that it's not you, it's a massive system going on, and there's so many people unemployed. It's definitely your mental, where are you in and where you're at, and being kind of easy on yourself as well. But Pat, you probably are better at that. You see more clients around.
Yeah, it's exactly why I originally, 18 years, I was a executive recruiter, and I switched sides because the system was already broken. The black hole already existed. When you applied for something, you heard from nobody, even though the system could send you an auto response, it doesn't. I mean, heaven forbid you take a moment to make that happen. And it's only gotten worse. So it's really a matter of, I focus on what you can control, because you can't, once you submit that application, it's out of your control. What you should be focusing on next. And that's exactly why I wrote my book, is like, the system isn't going to work the way you think it is. So don't be sitting there just filling out job applications online. It's about networking, getting, even in your neighborhood, your neighbor, that nurse's neighbor 2 doors down could be somebody who could provide a lead for her, and she doesn't realize it, right? So it's like, get out of your comfort zone, because it's, for most people, it's a comfort zone to have conversations with a stranger. And when you're new in a city, you're a stranger. The good news is, I think that the one advantage to take of is people are looking for people to talk to because they've been isolated. So there's a good example, whether it's her, there's plenty of people in a similar situation. But here's the main thing is, the system is broken. Expect that you're not going to hear, and take charge. Take charge, take control, and get in action. And just know that you're not going to hear, so you keep talking to people. Very, very difficult. You got to know how to use some platforms like LinkedIn and get really good at that, because that's what I'm teaching people now, how to take. We were talking earlier before this panel started about organizations taking in-person meetings and 3 and 4 day events and putting them online. I teach people how to make LinkedIn like a live event and how to start conversations on there. But there are certain occupations, teachers, nurses, those kinds of folks where they've not been on a platform like that. Well, then they need to use Facebook. Whatever, Facebook's probably a better meetup for that population. I know I have many, in my age range, I have many alum that went to high school with me that became nurses because we were only given 2 options. Well, Pat, do you want to be a nurse or a teacher? It's like, I don't want to be either one of those. But that's what you're presented with, right? So big group of my class became nurses, and they're really networking on Facebook in our groups and stuff. So you have to find other platforms, but expect not to hear and be in action.
Yeah, thank you.
Pat. Nancy, in the interest of time, I wanted to ask you, we talked about there's some gadgets, because nowadays, we have elderly parents living in one area and, children are living someplace else. You're worried about, especially also now with the COVID, where you're not able to get into the assisted living facilities. How do you keep a check on them? So there's some, technology-wise, if you can share that information. There
is, of course. Those that make them probably wouldn't want them to be called gadgets, but yeah. So they kind of it's 2 separate parts of the market is probably the best way to say this. One is like my mother is 94, still lives in her home with stairs, scares the Jesus out of all 4 of us. And so a couple years ago, I put a device in her house, and it's called a GrandPad. And it's a company that is very well known now to keep social isolation away, to keep them active. And you get emails, and you can get music and different things sent on. But the basic thing is that all she has to do is push my picture or my brother or my sister's, and it makes a video call and connects to us. And we can do the same to her. That's all the only way I talk to her is because she's been isolated. She's been climbing the walls. And so it doesn't have any peripherals, is the gadgets that we call them, Rajitha. There's no peripherals. So there's no pulse ox. She's got a separate pulse ox, but it doesn't attach to anything. And so it's just video, and it's just a way to keep socially active in that space. We can do group calls, things like that. So, and it's so easy, and especially built for seniors. It has a special screen because as we get older, we lose moisture in our fingers. So the swiping of a face, a regular phone doesn't work. And it took her a while. I got to tell you, it took her a while to get dependent on it. And it became a part of her life when her house lost power. And the only thing that was lit up was this GrandPad. And she pushed, my sister was closest to her. So she pushed my sister's face. Of course, it scared my sister because here's on her cell phone, mom calling from GrandPad. What? And it was, I lost power. What do I do? And so they immediately came over and checked it out and brought her a lantern and everything. So she's now very, very comfortable with that tech. When I gave her a cell phone, it's plugged in on the counter when she left the house. But so that one didn't work, but this does. So if you look at it from then a clinical aspect, or just being able to monitor if you're getting up or your mom's getting up, you can put things in their lights, the light switches. And so very unobtrusive in the background. Is the normal routine happening? So that's something that I, as a daughter, can do. There's no clinical value to that. I just know if she's moving around or not. Because if I call her house and she doesn't answer, I get a little worried because she's supposed to be there, right? So in a clinical fashion, there are companies, and one of my companies that I work with is a company called Live Care, and they have these, I don't know, can you see it?
Yes.
So this is what we call a hub, and there's peripherals or gadgets, so this connects to a blood, regular blood pressure monitor or a weight scale. I'm not getting on the scale for you guys. And they Bluetooth to this. So once this comes in, so this is a physician prescribed program, and the data goes up into a cloud, and that cloud is then viewed by their nurse or their doctor, and there's set parameters on if Nancy's blood pressure or weight, or depending on what they're looking for, right? Because the comorbidities are strong and there's a lot of them. So what do you have and what do you need? And then that data can be sent to the family member or the non-clinical caregiver. So I know what my mother's blood pressure is, because she's been known to fudge a little bit on what that really is. And now I would know it. So all of these types of devices, once this goes into the home, it works on cellular. So I don't need to have a Wi-Fi in her house or someone's house, because most of them don't. It works on cellular, just sits in the background. And all of these, I put my finger in here and it automatically sends the data up. Same thing with the blood pressure cuff. So it's very seamless. And what we have found in all of this is that, one, physicians love it and the patients love it because they feel more cared for. Someone is outreaching to them when there's something different or they miss it. I can also monitor medication adherence. So the adherence to their program of taking their blood pressure, taking their weight, or watching it, being able to see it and being able to then see graphs and of what they're looking at is actually helping the patients increase their work in their own health. And that's kind of one of the things that you want to do. The adherence numbers are really strong when they have these easy to use devices that can monitor their health.
We call that patient engagement.
Patient engagement, absolutely, Anne. And if they're engaged in their own health, then they make the right choices, right? And I don't need to do that. I would normally do that, but if I weigh 2 pounds more tomorrow morning, I'm going to get a call from Nurse Nancy because I'm not supposed to be taking that much salt or whatever it is. They start to see the ramifications of their actions.
So,
and telemedicine is part of that too, so that they can, there's a bigger version of this if there's a telemedicine platform that's involved, so that they can actually talk to their doctor or nurse as well.
Oh, wonderful.
Yeah.
So
and they're paid for it.
connected
So
to the
pays
physician.
for it. Yeah.
The physician.
The physician. Yep. Physician gets it and they get paid for it. CMS, Medicare, Medicaid, and private pay pays for this. So it's now part of the regular program that they can be put on. So.
Okay. Anne had to jump off. She had another meeting to go to. I know as we are wrapping up, I just wanted to also bring in another piece of it. Ask Vandita real quick if you can unmute yourself, Vandita. Wanted to ask how does dance? I know, we talked about mindfulness and meditation and all that. Dance is also one of the way of expressing, like an expressive meditation, de-stressor. So tell us a little bit about that, please.
Definitely, like Ms. Nancy just spoke about, being engaged in how you want to keep yourself healthy. These days, I see irrespective of the age. I have students who are as little as 5, and I have adult students, and I have a very, my favorite student who's 79. But at the same time, they are so engaged in keeping themselves fit, not just physically, but mentally too. How does dance help here? One, dance is very therapeutic. Music in itself is very therapeutic. It's very holistic. It may not be that they may be able to stretch to this level or to this degree, probably not as, their legs may not be as straight as what a 6 or 7-year-old may be doing, but their very desire to do it, the very desire to actually attempt it, itself is therapeutic, and dance helps there, dance yoga helps there. And I've seen it connects people, thanks to Zoom now. People of all different ages are all together, asking each other doubts. Hey, I didn't get this step. Did you get this step? How did you do it? And they send me videos of how they are doing it. I send back feedback that this step was not rightly executed. You should have done it this way. Oh, my arm hurts when I do that. Oh, my feet hurt. Oh, my hip hurts. Oh, then why don't we do it this way? And there are very alternate efforts and alternate ways to get that step done. And Now I see that dance connects people. What was difficult to voice in words, what they were very hesitant to say because of age, what they were shy to bring it about. In a class too, probably, when I had all these people of different age groups come together, I would definitely have somebody not be able to tell me, hey, she's able to do it, but not me. And she would not tell me that and wait for everybody to leave. And then she would come and approach me and say, is there any other way I could do it? Because she's able to do it, but not me. But today in this Zoom lessons, everybody's talking to each other. They are trying to, connect with each other, understand their limitations, but come up with a way where they could meet their limitations. And plus, now that the time to travel is no more. They don't have to spend that much time traveling. So we have excess time in hand. So more and more people are joining in, and dance helps them keep themselves physically fit, mentally open. That's what I tell them. That what, according to me, dance will help you is to express yourself. It's a freedom of expression. How you express, what you express doesn't matter. Just express. And once that barrier is, broken, I think we are all. It's just happiness. We just connect with each other.
All right, great, thank you. Um, I just wanted to say, address one issue. Earlier, we talked uh, about the genes that we carry. Um, there's so much of research done. We used to believe that, this is it, this is our genes, and we have to deal with them. Or if something has happened, like, Anne said, she had gone through health issues, and you just, but no, she picked herself up and, expanded more. What other ways can she work? What other ways can she contribute? So I want to say that genes are not our destiny, and we have had some speakers last 4 days talk about it. Dr. Patel, Dr. Rahman. Genes are not our destiny. It's the lifestyle that we live. It's really first what we need to do is set our intention and have a focus that we have talked about even in this panel. That setting our mindset and spending that time for we have to set that time aside for us, where you carve that time out, because this is your well-being, your mindset, the meditation, the exercise, and all these things do not have to be, does not have to be a paid thing. You can just crank up the music and dance. That's your exercise, that's your stress reliever, that's your expressive meditation. And use a journal, expressive writing. Gratitude is a big thing. So many studies have shown that gratitude helps. And community service, go out and do some community service that helps. And eating nutritious food. And also, I wanted to talk about the soil health, which we don't have time, but you know, understanding where our food is coming from, because we have had Jeff brought in a very good presentation during the last 4 days about our soil health, the fruits and vegetables, the nutritious meals that do come. So I just want to let all our audience know that genes are not your destiny. You can change however you want to. You can change the expression of your genes and live a good, healthy life. Does not matter where you start. It's never too late to start. At any time in your life, you can start your process of that. And earlier we talked about, what can we do for the community? So I just wanted to go around to our panels and see what can we do, in terms of what do we want to take it from here, and to our groups, where the communities that we are going in, how are we going to make a difference? So let me go with whoever is unmuted right now. So Sharda, can you just briefly tell me, I know you already work with women's organizations, if you can just, what is your commitment? What can we take into our community?
Yep. Actually, if you look at India, the major shift has happened after the opening up of our economy in 1990s, and we have a big increase in obesity and diabetes. And obesity in adults increased from 9% in 1990 to 20%. And there are, for every 100 overweight adults aged 20 years and above, there are 38 adults with diabetes. So these are some figures which are very, very, problematic, and which really flag the issue. And there is an urgent need to change our food habits, particularly in India, because the traditional food habits have changed considerably thanks to the fast food chains and the aggressive marketing that happens. And children and even young adults are quite hooked to those. And there is also this whole change in the routine of this 24/7 media and internet have ruined the routines, sleep patterns, and also working in BPOs and all, and the time zones are blurred, and so people are working at odd hours. So there are a lot of things, and in this whole in this whole context, usually the food habits take a toss, because you eat a lot of food that is available in the canteens, on the road, or in the food chains, and you're not actually eating a balanced diet. So I feel that it is very important that we focus on changing the food that is served in canteens in schools, colleges, and workplaces, make it more healthy. And I think it is a responsibility of the institutions to have regular counseling and training programs for parents, children, guardians, and the employees, and also use social media smartly to reach the young people with good role models promoting healthy lifestyles. But I would like to qualify this statement by saying that it's very important to ensure affordability and availability of foods such as vegetables, fruits, etc., which are quite, sometimes they're not available, sometimes they're beyond the capacity of the people to buy. In our villages where we are working with women's groups, we have found that promoting kitchen gardens and growing fruit trees has really helped in improving the nutrition, because even in the midday meal scheme where they give only grains and pulses, by creating a kitchen garden in the school or in the nutrition center, the preschool center, we have been able to introduce some greens into the food, and then some vegetables which are regular vegetables in the rural areas like brinjal and spinach, etc., which they could add to the food that they are making. So we need to look at nutrition in a much bigger context of uh, poverty and also geographical location. Like some people who are well to do, but they are not connected by roads or anything. They are living on hills and far away, and so they manage with the basic roti and pickle or something like that in India. So we have to address issues of poverty, distribution of food grains, more efficient distribution of food grains, and addressing the issue of hunger and malnutrition, which is a very, very big issue in India, because child malnutrition is one of the worst. India is one of the worst countries, worse than the sub-Saharan countries. So these are some of the issues which we really need to look into, apart from the middle classes going for the junk food and food chains and other things.
Thank you, Sharda. Yeah, I was just looking at more of a smaller area that we can do. I think Vandita had mentioned that she does work with her students where they can make, with the community projects that they do make a difference in that. So going to you, Letha, just in your small, just the difference that you can make, not as abroad. We can't bite up the whole apple, right? Just small bite at a time. What can you do for your community? Any change from here? I think, Letha, you're muted. If you can just unmute yourself and just say what would your contribution be to the community.
So lifestyle modification or change in eating habit or even any habit or behavior modification is not an easy task. A lot of factors We don't need to discuss all. However, the education or the information going to a specific individual needs to be individually tailored, culturally tailored. If you come and talk to me about eating all lean when my eating pattern is absolutely the opposite way, on just one night, I cannot change and become healthy, because all the belief I have is my body is supposed to be looking this way to be healthy. So you are coming and showing me these numbers to make me look beautiful and healthy. It probably may not come and sit in my brain as it is something I can do, or it is something I need to make. So you please tell me that even if I don't change my dress size, even if I don't go down by my weight, increasing my physical activity will make my body cells sensitive to the insulin. So I may not develop diabetes if I am physically active, even if I don't look as skinny as you and the other people who are having the beautiful shape. So tell me what will make me think about adding some physical activity. What will make me, and also talking about physical activity, if I am working 10 hours a day and then going home to help the homework of the child and then to fix the dinner and then to have everything and go to bed immediately after grabbing my dinner, and then you are trying to put me to the gym and you want me to go forgetting all my cultural beliefs and exercise with the men. No, it's not going to happen. Tell me, do not take the elevator, go up and down maybe 1 or 2 times after 2 hours of sitting in your office. So bring the points which is tailored to me, which is probably doable for me and culturally palatable. So I think this
Right.
is the way I approach my patients. Older adults get up, go and check the mail, maybe around 10 o'clock. Again, after 12 o'clock, go and check. If you are going to the supermarket, park your car in a farthest parking place, not in front of the Walmart. So that I say, like, cardiovascular parking, which is farther from the mall. And then in the mall, don't take, the scooty, just walk. Here, one time you go and look at all the aisle, that means you're getting some physical activity. So creative way, individualistic and culturally tailored, that is the only way I can get people make their behavioral changes. Smart goals, small, measurable, achievable in a limited time.
Thank you, Letha. Pat, what can you do? You're muted. If you can just unmute yourself.
Yeah. Really what I focus on with my clients is two things. And I do it now and I do it passionately and I will continue to do it. One is mindset. I get them to realize, I tell them, and I heard this myself somewhere, I didn't make this up, but when you're inside your head, you're behind enemy lines. So I get them out in front and out of their head. That's number one. Number two is sleep, because sleep impacts obesity and impacts everything, right? So I know that if I can get them to get a decent amount of sleep and focus, if you're going to study one thing, study your sleep and how to get better at that. That will help your mindset. Those are the two things I really focus on. And when I see that there's a window of opportunity, I encourage meditation. But they're not ready to go from a busy mind, to Letha's. They're not ready to go to a busy mind. Most of my folks are busy people, so I have to give them busy things to do to a certain extent, and then ease them into that. But and by the way, if I had to choose one thing, I would focus on sleep, because if they get enough rest, their mindset, they'll be able to handle the mindset shifts much better. So for me, that's the one part I can control. And I know that if I get them to manage their sleep and I get their mindset straight, they'll start to eat better, take care of themselves better. They'll make themselves centered. I have to do it, just as she said, baby steps right there. Yeah.
Great. Thank you.
Yeah.
How about you, Nancy? If you can just unmute yourself, Nancy.
Yeah, I think, actually, I think Vandita talked about it, but I started this path, how can you help others in your community? My husband and I, and Pat will laugh because she knows about this. My husband and I go walking and we pick trash up as we go to clean our neighborhood. And we had to start actually taking different routes because they were too clean. We had to go to find a dirty route. And we started to see other people do it. And we thought, yay, right? For a while we'd get thank yous and that's really great. And it was like, how come nobody else is doing this? Because we see people walking all the time. So I think one is just to make sure that your community, that you see all that. But I think choosing the thoughts that serve you as well is a big thing. And I find that I've been talking with a lot of people about that. It's like, you don't need to go down that path. That path, to the point where Pat was saying, that things that you can control, if they're not serving you, why are you dwelling on them? And so it's just to get a better focus on that. Today's a gift. Choose the thoughts that serve you. It just centers you and helps you learn, kind of keep moving is probably what I would say. Those are things that guide me.
Okay, wonderful. Thank you, Nancy. Vandita, you wanted to add something in, if you can unmute yourself.
Yeah. What I was hoping that the parents would also start understanding, it's not just the physical well-being of a child, or irrespective of the age, all of us think about our our physical development, our monetary development, careers development. We think about all that, and we tend to forget that the mental health is also a very important part, So I wish that the parents would start, inculcating that in a child right from the beginning, that, hey, you have to have time for school, you have to have time for homework. At the same time, you need to have time for your mental release. It could be sports, it could be art, it could be dance, but it should be a part of our everyday routine. Unless we put that, and especially I'm also guilty, I guess, being an Indian parent, many a times we insist on, have you done your homework? Okay, then the day is accomplished. No. Have you done your homework? At the same time, have you found some me time? Have you done something? It may be doing nothing, but have you done something for yourself? Once we start inculcating that from a very small age, it gets habitual as we grow older, and we do it for our children, and that continues. So that's my goal by introducing dance in the mental well-being.
Great, thank you. So this is my commitment. This is our 5th day of this health summit. We have given so much of information to our audience, and quite a few of them don't know what to do with this information, where to start, and how to put that into the lifestyle. So I am opening up a small group sessions for people, whoever want to join in, how they can make their own plan and start moving from there. So they just need to sign up with me. So I will help them guide how to move forward, all this wonderful information that we have, so that in building their healthy lifestyle. And number 2, I don't know, I'm sure y'all can chime in, or the audience, whoever can help me. As I was just talking, I thought about it, where I want to try to see if I can have like a gardening project in our rural areas, where our vulnerable population have not much access to the grocery store. It's easy, they're right around their neighborhood, they have more of fast food. Introducing them to more fruits and vegetables, where we can have children do those projects, and so it could be like an interaction, different generational and gardening project, and also helping with that loneliness and all that. So that's one of my project. I have to do some research and get to that. That's one of my goals that I would like to do. So as we are going towards this, I just wanted to, say, I know we have been here for a long time, and I want to thank each and every one of you, and especially our audience, that without you guys, we would not, have been able to do this presentation. And thank every single one of our speakers and our panelists today for your dedication and for your time commitment to come and give us this wonderful information to share with everybody around. So this is going to be continuing on because we are committed to our community in building healthy lifestyle. And I want to close it by saying what Dr. Dean Ornish said. There's only 4 things you have to do to have a healthy lifestyle: eat better, stress less, move more, and also love more. So these are the 4 things. If we can incorporate into our life, then we can just see how we can evolve right from here, and we'll be just glowing. So I just want to thank every single one of you guys for your time and for being here with me and supporting our community and for all your insights.
Thank you, Rajitha.
Thank you, Rajitha.
Thank you. Thank
Thanks
you,
for having
Rajitha.
me.
You're very welcome. So,
Thanks all. Have a lovely, lovely day.
Yeah. Namaste.
Namaste.
Yes.
bye.